Hello, everyone, and welcome back to Executive Uninterrupted. I'm Saul Marquez, your host for the day. And today I have the privilege of hosting an outstanding leader in healthcare and in the payer space. His name is Nebeyou Abebe. He is the Senior Vice President of Social Health at Highmark Health, where he leads enterprise social health strategy across the system, serving 7 million members, bringing 2 decades of experience spanning public health, global well-being, and also population health and health equity. Nebeyou, so glad that we were able to make this time work.
Yes, thank you for the opportunity. I'm looking forward to sharing our story.
You guys are up to some really great stuff, Nebeyou, and really just grateful for the opportunity to highlight it. To begin with, I want to just recognize the recent work that you guys did on really a Health Affairs Scholar release, the design and early evaluation of social care networks' impact on healthcare costs. I'll give you a chance to chat about it. And in particular, what sort of caught my eye is that most health systems say social determinants drive 80% of health, but few can show the receipts. Talk to us about what this is all about and why it's not just a program at Highmark.
Thanks for the opportunity, Saul. And yeah, we're very proud of this new publication that highlights our homegrown social care network. So the social care network, in essence, is a curated network of community benefit organizations that receive referrals from both Highmark, case management, social work teams, as well as Allegheny Health Networks, case management, and group of providers who routinely screen all their patients for social determinants of health. And so what makes us unique is that we've operationalized social determinants of health across the enterprise, both on the payer provider side, and that presents us opportunities to co-design solutions and evaluate them to determine whether or not they've delivered value back to the system. And so what we've been able to prove out with our social care network is that we've been able to reduce medical spends significantly, close to a $700 per member per month, sustained over a 9 to 12 month period, which is very significant. And so, again, we're very proud of the work. It builds upon the evidence nationally, because a lot of people, as you mentioned from the outset, they invest in SDoH, but it's at the community level, and they oftentimes struggle whether they're using grant dollars or their own investments to effectively measure the value and impact of the programs, because it's open to the broader community and it's hard to assess both clinical and claims data like we've been able to do, and then share our findings with the broader stakeholders doing work in this space. So again, it really empowers all of us like-minded leaders and organizations who understand the impact of socioeconomic factors in our members and patients and customers that we serve. And having come from the public health sector at the national and local level, we've been trying to get to the place that we're at today, which is hardcore evidence that well-designed interventions can actually improve health outcomes and help to reduce cost.
Just congratulations, right? This is big, both the results, but also the fact that it's been systematized and made part of the program within the organization. That's a huge difference maker. So congratulations.
Yeah. Thank you. I really appreciate that.
For sure. And so let's keep talking about this, because I think it's a really important topic, Nebeyou. Social health. It's still a term that many organizations are figuring out how to define internally. How do you describe it to a skeptical executive? And what does it actually look like as a strategy at the scale of Highmark?
Yeah, so I would say a few things. One is, again, I'll highlight the payer provider integrated model that we have, which really helps us immensely because we have the necessary engagement from both the payer and provider side. I would also say that it really requires internal leadership who is very supportive and really leans in and puts money where their mouth is. And this is really driven all the way, not just our executive leadership team, but our board as well is really active in this space. And so we've been, over the last, I would say 5 to 6 years, really on a path of proving out that an investment in this space can actually deliver tangible value back to the business. with that being said, we understand our role as an anchor institution in many of the communities that we operate in, that we have a corporate responsibility, both as a payer and a provider, to ensure that the communities that we operate in are vibrant and thriving. And so we make significant investments to advance community health out of our community affairs segment of our organization that does really great work. And then we also understand that when I say all health systems and health plans and other key stakeholders in the healthcare ecosystem, are all grappling with how can we really engage and build trust with our customers. And really it starts with taking a consumer-centric approach, not just in the design, but on the execution. And so we quickly realized that we needed to have our customers inform the design of our work and then have it be structured in a way that we could implement it in the way that can help us long-term with scaling and sustaining test and learn initiatives, but then also having the internal alignment and collaboration needed from many different stakeholders to be able to execute against the strategy. And so we've created a social health center of excellence at Highmark that my team heads up that helps to coordinate all these activities across the enterprise. And that really helps us to get all the critical inputs we need from these key stakeholders with respect to strategic planning. But then also when it comes to the implementation, the evaluation of all the work that's in our strategy, really takes a collective effort. And so we have that alignment internally as well as externally with our community-based organizations who are really the ones who are servicing our members and patients at the community level, the grassroots level, who are helping us to establish the trust that we need from our customers. And oftentimes, I'm sure many of our customers don't trust institutions like ourselves. And so those community benefit organizations are really critical in helping us effectively engage our members and through that engagement address their socioeconomic barriers, which can make up to 80% of one's quality of life and health and well-being that drugs cost. But then they also help us to build those trusting relationships that connect both the community resources with the clinical and create a really strong payer-provider CBO model that through rigorous evaluation has proved out that it does help us to enhance the member experience. It helps us to close critical care gaps. It helps us to improve health outcomes and quality of life, as well as what everyone's focused on, reduce unnecessary, avoidable spend. And when it comes to SUH, that's what no one has really been able to do at scale, is to figure out what is the right intervention that can address the need, but then also lead to business value.
Yeah, and you guys have certainly done that. A lot of great points here. And I imagine, too, there's some really good upstream impacts to shape policy out of the work that you're also doing.
Correct. Yeah, this is still, even though people have been working on SUH for 30, 40 years, it hasn't really been done at scale and hasn't really been done in close collaboration with all the stakeholders, right? You could have a nonprofit organization over here doing good work in isolation. You have a payer that's making investments. You have hospital systems, you have the government, you have foundations. All these different organizations are doing good work and they're spending money. What we've been able to do is reach out and deeply collaborate with all those different stakeholders that have shared goals and objectives. And we're able to pull our resources together, whether that's brain power or if it's data and analytics or if it's on the execution of the program. Everyone has been playing a part. And we've been able to coordinate all of that seamlessly. And that's really what it takes to drive these types of results.
Yeah, that's great, Nebeyou. Really just impressive work that you guys have been up to. Just getting to know you better, you moved from a global role at Sodexo, where well-being was framed through the lens of workforce and services, to a payer-provider system like Highmark. How did that shift change the way that you think about what health systems owe their members beyond clinical care?
Yeah. And before working for Sodexo in that global health wellness role, I was in public health for about 12 years. And so I have the public health, the multinational corporation, and now the payer provider sort of experience. And I had no idea that I would work for a multinational corporation before I did, and didn't think that I would work for both a payer and a provider organization, which now I am. And I think it happened organically. And I think every unique experience helped position me to excel in the next experience that I was given the opportunity to pursue. And now I feel like two big stakeholders, right? A payer provider has lots of influence and it has a lot of tentacles to be able to pull in different individuals and organizations that have a diverse set of views and perspectives to help shape and inform our work. So I think that's the big takeaway from all the experience I've had at the global, national, state, local level is there's lots of individuals and organizations that want to do good work. How can we bring everyone together and align around a common language and a common way of doing things to drive change, transformative change that can influence policy? I'm very proud of the work with the Social Care Network that took a lot of effort. And now we are socializing the results with policymakers and regulators to influence how they shape policy.
And in your view, Nebeyou, like what's the win? Like you guys are releasing this 3-5 years from now. What does that win look like for you?
The win looks like, and I'll share the win from different sort of angles and perspectives. I think like for someone in my position, I feel a lot of gratitude and feel a lot of joy with being able to create this systems-based approach that improves the lives of our customers. And then if you look at it from a payer's perspective, right, we're helping to enhance the member experience. We're helping them to understand that we're not in this just to process claims and just be their traditional insurance provider. We are here to support their entire health spectrum of needs that they may have in their entire journey. So this is a big part of it. Everyone knows SDoH can impact up to 80% of one's health and well-being. But how do you actually do that in a meaningful way that where the end user, in this case, our customers actually feel that? So I think from a payer's perspective, there's lots of benefit from all of that. And then the cherry on top is helping to control rising healthcare costs. From a provider's perspective, they know that many of their patients that come through their doors don't need to be there, that there's a better care setting for them. And now they have the necessary resources support to actually do their job better, right? Because they've been trained mostly in medical school to address their physical health needs of their patient population. But now they're able to do something about their social needs, right? In meaningful ways. And they get to see the data back, and that helps them to trigger the next best action. And so lots of value there. And then from a government perspective, helping to control rising costs as well, so that they can then make investments in education and infrastructure, so on and so forth. So there's lots of value created from this work. And I'm just very proud that we've been able, again, to create a model and a system that generates real value that is shared among all those different stakeholders.
Totally. Yeah, love your vision for this, Nebeyou. And a lot of this stems from like the previous work you've done. I know early in your career, you directed a CDC campaign specifically designed to reduce stigma among young African-American adults. What did that work teach you about health communication that still shapes how you approach strategy today?
Yeah. And I feel like that is the basics when it comes to social marketing, health communication. You have to find a way to communicate, right? Not just develop random health messages, right, that you can just pull from Google, but how do you develop the right message with the right messenger? And all of that is informed by taking a consumer-centric approach. Like when I was doing that work, I never developed messages and figured out who is going to deliver the message in a vacuum. We'd conduct focus groups and so on and so forth. And I carry that important work. I bring that with me to everything we do. It's not just the team that I manage that should be driving the strategy or designing the programs. It should be informed by the end users, right? So yeah, that was a great experience. Jamie Foxx was one of my celebrity ambassadors, and
which is awesome.
Again, he checked all the boxes, and it was a lot of fun hanging out with him in LA for half a day, and
that's really cool.
Cracking jokes all day. But that was back in 2009 when we launched that campaign. A lot has changed since then with the advent of the internet and social media and so on and so forth. But again, one thing learned back then, and I continue to practice today, is making sure that you engage the end users from the very beginning to help inform the work, because then the end product would most likely help you achieve the goals and objectives that you set forth.
That's awesome, Nebeyou. Yeah, like we don't want to do any of this work in a vacuum. And there's a lot of creative things that we could do to activate these campaigns and programs. Influencers, celebrities, research. And Nebeyou, you've done many of them. So I love that you're sharing that experience here. There's often still a gap between what large health systems and payers say about equity and what they're willing to structurally change. From your seat, what does meaningful progress on health equity actually require? And where do most organizations fall short?
Yeah, I would say number one is having a dedicated team of experts who know this space and can work well with all the stakeholders that need to be engaged. Second thing is having the leadership in place who really supports you and provides the resources you need to be successful. And at Highmark Health, it's, again, the board all the way down to the executive leadership team, all the way down to the managers that help support our work. I think that's critically important. And for many organizations, they just don't have the resources or they don't have the support or a combination of both. And so we're very fortunate to be in the situation that I'm in at Highmark. And also, again, being both a payer provider gives us huge advantages over others who are just plans, who are just health systems, right? Understanding both worlds and making the economics work, but not just the economics, making the operations work, right? Because it really requires engagement from many people who need to be incentivized properly to really drive that behavior. So a lot of change management needs to happen. And in order for change management to actually work, you need that trust among all the people that are on this journey with you. Trust in that this is the right strategy, trust that you're able to execute, and trust that, this is the right thing to do. We have the right alignment, we have the right incentives, and we have the right support at Highmark to really be successful. And I'm just really excited about this journey. Social Care Network is just the beginning. We're going to continue to scale that capability, build new capabilities, and really position Highmark Health for even greater success moving forward.
Well, Nebeyou, this is fantastic. I'm really appreciative that we were able to get you to come talk about this important work that you guys have just finished and you continue to do. Folks, in the show notes, we'll leave all the ways to learn more about the program that was just published by Nebeyou and team, as well as all the work that him and the Highmark team are up to. Nebeyou, if there's a closing thought that you want to leave us with, what would that be? And then where's the best place people can reach out to you to learn more about you and the work that you're up to?
Yeah, I'll say keep grinding, keep at it. And there's the light at the end of the tunnel. And if anyone wants to reach out to me, feel free to email me at nebeyou.abebe@highmarkhealth.org or just look me up on LinkedIn.
That's outstanding. Nebeyou, thanks again for spending time with us. This is a really great opportunity.
Thank you very much.